If somebody suddenly develops loss of function in one of the arms or loss of function on the same side of the leg, what you call a stroke. Some people call it a partial stroke because it happened on one side. That's not what a partial stroke means. A partial stroke is a stroke. Of course, one side went off and then came back as if it never went off. That's what a partial stroke is. You know. So what you're calling a partial stroke is an actual stroke. And a person can come back from that, even though they did not technically have a partial stroke. You can make a real stroke a partial stroke if you do what I'm about to say in this video. And I used to advise people to share medical education videos because that's the cheapest way you can save a life. Let's even look at things like sickle cell anemia. When you see, we're in the hospital, I don't know how much exposure you have to children that have vaso-occlusive crisis, or adults have vaso-occlusive crisis. Friends that are always going to the hospital because they have sickle cell. The parents who got married purely out of ignorance, they had the ASAS hemoglobin genotype, and they got married. If you could advise them with a very compelling voice, you probably would have done that. If someone like me had pulled out one of my ears in a warning video and bled from my ears, you probably would have sent that video to everybody you need to discourage them from doing that type of thing. If you actually see another individual, a third person that was not involved in the supposed foolishness of two adults, supposed foolishness, and the third person was not even there when they made decisions, and then they show up with damages from that decision. When you see that type of picture, you look at the parents again, and it's regret that you're not going to kill that person to take their pain away. What you use to manage pain that will keep coming. So this person's life revolves around being sick and being in pains because of decisions two other adults made in his absence or in her absence. So something as costly as that could have been avoided by just educating them. There are people who try to play the games where they get married and believe that their first, second child will not be that. These people are informed. Those ones, you don't have anything, there's not too much you can do for those people like that. But those ones that are avoidable are people that don't even know. They just go ahead and get married without having their genotypes looked at. So it's the same thing. Well, and what I'm talking about. We don't know when they say cerebrovascular accident. The third word there is accident. What it means is that it can happen to anybody. These are some of the things that humble me. Every time I'm in the hospital and I see people who are sick from things that they did nothing to deserve, like a cancer can just randomly pick anybody. Sometimes all of us are exposed to the same risk factors, because most of these cancers doesn't have a direct cause. Most of them, So why one person comes down with cancer and the other person does not, is purely based on what you may even call luck. So you don't know when you will suffer this accident, this cerebrovascular accident, and it's cerebrovascular because the blood vessels that carry blood to the brain are the ones that have become either blocked or has broken. So you want to, in the first 3 hours, before it's 3 hours, to get a scan, a non-contrast CT scan of the brain, to tell you if the vessel that's carrying blood to the brain, whether it blocked. So all the blood in the body exists inside pipes, veins, and arteries. The arteries are inside, they're hidden inside. The veins, you can see them through the skin, where you put your cannula and give drips and give IV injections. And those pipes take blood after the body. The arteries take blood out. The veins bring back. So it's out, in that manner, in a closed system. There's no blood hanging loose anywhere. All the blood is inside the small pipe. So some of the pipes, you can't see them. So when you get an injury and you bleed from a small pipe, you couldn't see. So some of those pipes sometimes may accidentally get blocked. So the fact that it's an accident humbles me, because it can happen to me. It can happen to anybody. And what is blocking these pipes is the same. What is blocking the pipe is inside the pipe. It's the blood itself sometimes, most of the time. When it's a block type of stroke that happens, it's blood clot. And but people don't know what blood clots are. When you wound yourself and you bleed to the floor and the blood dries, that's clotted blood there, right there. Blood should not clot inside. There are mechanisms that keep blood liquid. But sometimes something goes off and it clots. When it clots, one of the arteries are sending blood to the brain on this side, which controls this whole side. And this side controls this whole side. So if any of the hemispheres of the brain has a stoppage of blood going to it, either because the pipe carrying blood their blood or the pipe carrying blood their blood, either of them will stop blood from reaching where it should go to. The person will have a physical sign, what we call stroke. You know. So when you do a scan, that is the only way today to know if it is a blocked type of stroke or a broken type of stroke. So if you're in hospital and your parent just had a stroke, or a relative just had a stroke, or a friend just had a stroke, and you've not gotten a scan in 2 3 days, the reason why they kept you there is because you're going to have to pay anytime you're ready to go. They're not doing anything for you. They are groping in the dark, trying to treat you. When you have a brain accident or a brain problem, you don't want people doing this when they are trying to solve the problem. You want them to definitively go and solve the problem. Because brain is the vital, if not the most vital organ. But you understand? So we'll just make an attempt to stay alive as long as we can. Everybody dies in the end. But when you have an accident, something you did nothing to deserve, you want to be able to come out of it unscathed if possible. And the way to come out of a stroke when it happens to you is to get a non-contrast CT of the brain before you need that to your, if possible, yes. If possible. Go there with the result. If you are the one who has a stroke, you cannot get a CT scan of your brain. It's the person who opened your room and carried you out that can do it for you. That person does not know. The person will use time and be looking for vehicle. The person will use time. Maybe call 911, depending on the where you are. The person will use time. And so in countries, in climes where things work, they already know what to do from that point. But in climes where the system is overwhelmed by the fact that people who are served, people who are served are being served, and more than people are served, and the system is not in a good balance yet. You're going to have to suffer neurologic deficits for the rest of your life if this is not done early. So look at how simple as it is. Probably scrolling, just relaxing, scrolling one evening. I saw this video. Something as simple as sending this video to every single person you know. Now, in the video, I'm saying send it to everybody to protect yourself. So when anybody receives this video from you, they know what you had in your mind because they will hear me say it. Then they themselves will probably send it back to you because they're hoping that you also protect them because you're the neatest person, the best person, the most intelligent person, most excellent person. All those things you are go off when you're unconscious. It does not matter what you are. What matters is what every other person is. So if you have people who are careless around you, people who don't move fast, people who don't even care about it, that is what your fate will be until you regain consciousness, if you will. So you want to get your neighbors as you early as possible so that you can get a bit of who you are when you are not conscious to make decisions for yourself. Do you understand? So all of us live in a very interdependent ecosystem. Even though we are introverts, we are whatever we think we are. At the end of the day, what the next person knows and does will affect you directly or indirectly. So this is almost like a direct way to color your environment. It's like a direct way to send this video out. We must differentiate from whether we have a blockage or a breakage. If it's a blockage, there is a way to treat it. And when blood starts flowing, function will come back. If done early. If it's a breakage, when there's something we do and the spillage that happens when breakage will stop and blood will continue going where it should go to, function will come back. If it's a blockage and we give what we should give and it breaks the block. If it's a breakage and we don't know and we go and treat it like it's a blockage because we didn't do scan, we'll go and spoil what the body was already trying to fix by itself. Because it's the same thing that causes the break that attempts to heal that causes the block that attempts to heal a break. So if I'm giving anti-blocker and I'm giving anti-blocker in a case where the blocker is one that's causing the healing, and I can give anti-blocker, you see, I've created another problem for the patient I'm trying to help. So most of the time, doctor will pay for your scan. Doctor will say, go and do. Sometimes they will even tell you go and do it early. And because of the system you are in, I'm making this video on everybody has access to internet. I'm assuming that people everywhere in the world are going to listen to this video. So I don't know how your health system works. But if you're in a space where people are told to do things, you're told go and do this, go and do this, go and do this, like they may not explain it like this. But because they know that your medical folder is a legal document, they will document that they said you should go and do. But you wish they gave you this type of emphasis. Take that pressure off your doctor and send this video to people already before they even have to see a doctor. Do you understand? It's better to have knowledge when there's no pressure. So that when pressure comes, you know what to do that second than to go and be searching for solution when you now have a problem. Do you understand? And the reason is because it's not like you can't work with that. Is you may find solutions and waste a lot of time. Time is very true. Share this video.